All right, we are live. Good afternoon, everyone, and thank you so much for joining us today for our Facebook Live. My name is Gabby, and I am here with Dr. Megann Sauer, who is a pediatrician at Boys Town Pediatrics. We are going live every single day this week for World Breastfeeding Week. So make sure you check out our events page and look at the class lineup to see if there are other sessions going on that you would like to join. So it'll be a really fun week. And even more exciting is we are also doing a series of giveaways. So if you look right above this video, there is a link to RSVP. So make sure you click that link and fill out the form to be considered. And then I will be announcing the giveaway winners at the end of the week. So great. Well, Dr. Sauer, thank you so much for joining us today. How are you doing?
I'm great. Thanks for having me and for promoting breastfeeding this week.
Yeah, definitely. So with breastfeeding, like I said, there are so many different topics that we could discuss. But to kick off the week, we are going to start with what parents should know before baby arrives. So to set the scene, you just found out you're pregnant, you're super excited, a little nervous, thinking about breastfeeding and all of the things that come with it. So we are going to talk through some of the questions to have Dr. Sauer kind of help alleviate maybe some of the nerves when it comes to it and to get you set up for success. So if you have any questions as we go through our Facebook Live, go ahead and leave them in the comment section and we will answer them at the end. Okay, so first off, what are, in your opinion, some basic principles that parents should know before their breastfeeding journey begins?
Sure, that's a great question. And just like throughout most of people's pregnancies, they're preparing and gathering information. So I think an important thing to start with is maybe speaking with your obstetrician about their thoughts or recommendations. And then probably most importantly is thinking about, as a new mom, what your hopes and dreams are for your child, and that would include feeding. And then using your support system, whether it's your spouse or significant other or partner, to kind of come up with a plan and to engage with them about how they can be supportive of you. And if breastfeeding is what you're going to choose, to make sure you have people around you that are there to support you and help you navigate that journey of feeding your newborn that way. Obviously, taking care of yourself in your pregnancy is going to help you to also be a successful breastfeeder once your baby arrives. And there are some things you can do to prepare, such as, getting some supplies like a nursing bra, maybe some nursing pads that line the bra to help with preventage of any of the leaked milk, not ruining your bras. And then like a nursing pillow. A lot of people use like a boppy pillow to help with correct positioning. And then I think just knowing ahead of time that breastfeeding is great for both mom and baby, I think gives a lot of moms reassurance that even though it's a lot of hard work, the benefits are worth it for the baby and for you.
Yeah, definitely. So there are a few myths kind of surrounding breastfeeding. Are there maybe some questions that you get from some of your patients or some common myths that you've heard before that we could maybe debunk right away just before the breastfeeding journey even begins?
Sure. That's a great question. And certainly with the internet now, you can gather lots of information, whether it's accurate or not. So before addressing specific questions, I think an important thing would be is just to make sure that you're accessing information that is accurate and from reliable sources, and especially maybe from your medical team of providers like your obstetrician. Or you can also do like a meet and greet with your baby's potential doctor and ask them questions as well. So I think make sure you get trusted information is good. But, some myths are, well, I have small breasts. Is my body going to be able to make enough milk? I think that's, one thing that certainly some parents can ask. And our bodies are pretty amazing and can produce milk no matter the size of your breasts. So that's one myth I think that is I've heard that's maybe not accurate. Doesn't matter the size of your chest. Other ones, let me think if I can think of any others. some people say, well, I'm supposed to breastfeed for, a full year. That seems like a really long time. I'm going to be going back to work. I don't know if I can commit to doing nursing for a whole year. And I think what most pediatricians recommend is breastfeeding for as long as it works for both you and your baby. Mm-hmm. And most of us recommend trying to do exclusive breastfeeding for at least 6 months and up to a year if that's possible. And then longer than that if it works for you. But the biggest thing is to try to come up with a plan that works best for you and your family situation in conjunction with your baby's doctor about what's best for them at the time. But that's another myth is, I have to do it for a year. That's way too long. So that's another myth I would say is not necessarily true.
Mm-hmm. Yeah, I love what you said about, just doing what works for you. And especially, before you go Googling all this stuff about breastfeeding, like you said, consult with your pediatrician because they are going to be able to tell you what is real and what is not, just like you just did. And Boys Town does offer free meet and greets with our providers, so I will make sure to link that in the comment section because you can set up a free meet and greet with Dr. Sauer or any other pediatricians even before your baby's born. So that's great. Okay, so we talked a little bit about nutrition at the beginning, but how can mothers prepare nutritionally to breastfeed? Should moms continue to take their prenatal vitamins? And do you have recommendations for food and exercise?
Sure, great questions. So just like when you're pregnant, it's important to eat like a well-balanced diet and making sure your body's receiving extra calories. That's really important in your postpartum period, especially if you're nursing as well. So the most important thing is a well-balanced diet. And then there's other things that your body requires. You need to make sure that you're staying hydrated by drinking plenty of water every day. And because of the increased needs that your body will have by producing the milk, you need probably maybe 500 plus more calories every day just to help make sure that you have an adequate milk supply. And most providers, if you're breastfeeding, would recommend that you continue to take the prenatal vitamins that you were on when you were pregnant. And then obviously you would just want to continue to have those discussions with your own doctor, your obstetrician, when you go in for your postpartum checks to make sure that there's no other additional things that they suggest. But usually, yes, the prenatal vitamins you continue to take while you're nursing.
Great. And similarly, what about medications? If we're on medications beforehand, kind of how does that work when you become pregnant and then you're breastfeeding?
Great question. And so a lot of people have discussions with their obstetrician about medications that they're on for either medical conditions that they have or any illnesses that might come up in the pregnancy. And those conversation should definitely continue in the postpartum period if you're breastfeeding. A lot of over-the-counter medicines, like maybe pain medicines that you would receive in the hospital after you deliver, or some allergy medicines. There are a lot of medications that can be used while you're breastfeeding. We would just always encourage you to discuss those medications with your obstetrician, but then also your pediatrician is a great resource. We get called frequently about medications that moms are taking and they want to know if they are safe during breastfeeding. And so that we're always a great resource because there are so many medications. We actually have a book that we can consult to make the proper guidance. And that can be done in conjunction with your own provider as well to make sure we're all on the same page.
Yeah, great. So after the baby's born, I have heard before that babies who are breastfed will need a vitamin D supplement. Is that pretty accurate? And if so, how do you recommend giving that to newborns?
Yes, you've heard correctly. So because many moms are deficient in vitamin D, the breast milk can also be deficient in vitamin D. And it seems a little bit counterintuitive because we always talk about that breast milk is best and it has, the complete nutrition profile that your baby would need. Mm-hmm. Vitamin D is sort of one little caveat with that. And so what we want to do is make sure that the babies get that adequate vitamin. And so usually in the one of the first visits with your baby's doctor, they'll recommend that you supplement once a day with a dropper. and it can be usually purchased over the counter, and it's just 1 milliliter once a day that the baby gets by mouth, just to make sure that the breast milk and the vitamin together provide all the nutrients that the baby needs. But your doctor will usually talk to you about that at one of the first office visits.
Okay, good to know. So what are the benefits of breastfeeding in relation to, you know, the immune system and bonding, postpartum healing? I'm sure the list goes on. If you want to talk a little bit about that.
Sure. So obviously, as pediatricians, we're huge proponents of breastfeeding for all of those reasons that you just listed. So if we talk about first from an infectious risk, we know that babies who are breastfed can have decreased infections like reduced ear infections, lower chance of pneumonia, lower risk of diarrhea like illnesses. And so no parent wants their baby to be sick. And so if by breastfeeding you're going to potentially decrease those chances, it's a huge plus and benefit. We also know that there's benefits for the mom and baby as well. It can help with bonding from that skin-to-skin contact. In the postpartum period, it can also help with like shrinking the uterine size down to a more normal size. It can help with losing some of the weight that you've gained during pregnancy. So between the reduced risks of infections, the increased bonding between mom and baby, and then also just the maternal benefits. Obviously, those are just a few, but some of the important benefits that breastfeeding can provide both mom and baby.
Yeah, that's awesome. So in terms of sickness, you know, with COVID and flu season around the corner, talk a little bit about, can sick moms breastfeed?
Yeah, I mean, we're all worried right now just with some of the, you know, with COVID and other illnesses. So great question. Usually when moms have a common or mild illness like an upper respiratory infection or cold, or maybe even like a gastroenteritis, like a vomiting and diarrheal illness, most of the time you can still breastfeed through that infection. Obviously, it's always great to talk to your provider or your pediatrician about it if you have questions, but most of the time we recommend continuing to breastfeed through those infections. And then if there's any more serious or significant infections or underlying medical problems that you would have, you would just want to clarify those conditions with your provider before breastfeeding. But usually if it's a common mild illness, you can go ahead and breastfeed through that unfortunate illness.
Okay, great to know. Well, everyone, we kind of just brushed the surface, I know, with everything regarding breastfeeding before baby arrives, but like I said, we are going to be live every single day the rest of this week over the lunch hour. So if you have a breastfeeding question that you would still like to be answered, please feel free to message our page or comment on this video, and I will make sure to include them for our guests tomorrow. But Dr. Sauer, thank you so much for joining us. This was a really helpful, quick video, and we really appreciate your time.
You're welcome. Thanks so much.
Yes. All right, everybody. We'll see you tomorrow at noon. Have a good day.